Hi everyone, welcome back to my channel. Hope you're doing really well. This is the second installment of my Mummy Mondays series. If you're new to my channel, I'm Fundal and I make a variety of videos over here. I do anything from hauls to come shop with me's to vlogs to cleaning and organizational videos, and now I'm running this series every Monday called Mummy Mondays on my channel. So I'm going to be discussing all things related to parenthood, pregnancy, birth, and everything in between. So today's video is my top 20 words and phrases you gotta know if you're pregnant, and also please be sure to share this with your partner, or if you know anyone that's pregnant, send this video to them. Now, I will say that I'm not an expert or a professional, so it is important that you do your own research, but I just wanted to bring you this video as if you were to ask a friend, let's say. I hope that I can give you some insight with my videos in this Mummy Monday series, and also we can have a laugh along the way. So I just want to be this space that you come to and that you can ask questions, or we can have a discussion in the comments, and it's a safe space where we can discuss all things pregnancy, birth and parenthood. So whilst the series is called Mummy Mondays, I don't want it to be just for mummies. I want the daddies to be a part of this community as well. If you do want to do further research, then I'd recommend doing like a Google search or going onto the NHS website. I use the NHS website, I used Google, and I also used the Oxford English Dictionary as my sources. So without further ado, here are your top 20 words or phrases that you must know during pregnancy and birth. So my first word is antenatal. Now you'll hear this word a lot during pregnancy. So antenatal means before birth, during and or relating to pregnancy. So you may hear this, for example, when you find out you're pregnant, you might visit antenatal clinics for your antenatal checks. And you might also attend antenatal classes. So these can be very informative, and you can just learn about breastfeeding, weaning, how to take care of baby, how to wash them, how to care for their umbilical cord area. So they are quite useful. So in the same vein as antenatal, you may hear prenatal and postnatal. So pre meaning before and post meaning after. You might hear take your prenatal vitamins, or you could have like postnatal care packages. I love gifting those, by the way, and I feel like they're like an essential now for mums that have just given birth. It's just like a nice gift to give to a mum when she's had baby, and she can just take care of herself a little bit too. Whilst I understand it's all about baby, it's important for mums to take care of themselves too. So word number 2 is postpartum. So postpartum means following childbirth. So as I mentioned, I like to gift postpartum care packages, and this can be where you just give mum her like maternity pads, maybe some essential oils, a nice candle, or if you can't light a candle where you live, then a nice reed diffuser, some chocolates, some nice treats for mum. You might also hear postpartum, where midwives talk to you about your postpartum care, so how you're taking care of yourself, and if you've had your postpartum period, which is like your first one after giving birth. And also there's like postpartum blues. So typically a few days after you've given birth, mums might feel a bit blue, a bit down, just because of all the hormonal changes the body's gone through, and also the sleepless nights when baby is here. Word number 3 is conception. So conception is essentially where the egg is fertilized by one single sperm, and that is the miracle moment of when the journey begins for your baby. So when you do go to clinics, you might hear your midwife or doctors discuss date of conception, or if you're trying to conceive and you know your date of conception, then this is used as an indicator of when your due date may be. Most women's pregnancy is calculated based on the first day of the last period that they had, and that's the indicator of when the due date would be. But if you know your specific date of conception, when baby was conceived, then that's just more of an accurate indicator of when your due date will be. And you may have read in magazines or heard through media of, you know, celebrities saying where their kids were conceived, and then they named their children accordingly. Word number 4 is due date. So as mentioned previously, this is when it's predicted that your baby is set to arrive and be with you. So you may hear, once you've announced your pregnancy, people asking, when are you due? When's your due date? And this just allows you to plan in your pregnancy and prepare for baby before they arrive. Your employer might want to know when you're due, so then you can plan your maternity leave accordingly. Now, in regards to your due date, most pregnancies are 40 weeks, and the due date given, although it is a specific date that's all in your notes and used between the different healthcare professionals, you will see it's not always that accurate, because if you didn't already know, it's not like a deadline. Baby won't appear on that specific due date. Can happen, but it's quite common that baby will either arrive early or even past your due date. So you may have heard like mums getting frustrated because they're overdue. So this date is, I would say, is more of like an indication of the end of the 40 weeks. It's an indicator of, right, for example, baby will arrive like on a specific date. If you're maybe going for an elected C-section, then you might choose your specific due date, in which case, yes, the baby will arrive on their due date. Word number 5 is trimester. Now, it's not like legal jargon where words mean different things. Trimester is, as it sounds, trimester. So this is 3 periods in your pregnancy lasting 3 months each, and during each period there are different stages of development for baby, and you'll experience different things in your pregnancy during each trimester. So the first trimester is from 0 to 13 weeks. The second trimester is 14 to 26 weeks. And the third trimester is 27 to 40 weeks. And again, you will typically see this in your notes, where midwives or whoever your healthcare professional is, they may, when they see you, write in their notes what trimester you're in, what week you're at during your pregnancy, and it just indicates what stage of development the baby is at. If you've not already seen the first Mummy Mondays video, I'll try to link it somewhere here, but in that video I've given my top 5 apps that I recommend through pregnancy and for afterwards. And there's a couple of apps that track baby's development week by week, or some even day by day. So if you're interested and you want to look into that, definitely check that video out. Word number 6 is a jumble of words. I want to talk about midwives, OBGYNs, and health visitors and doulas. So yeah, 4 words, bit of a bonus, but I just wanted to group these together, because during your pregnancy and birth and possibly afterwards, you will see these people through the different stages, and I just wanted to break down who they are and what they essentially do for you. So a midwife is somebody that's medically trained, and they assist with your labour and childbirth process. A health visitor is somebody that has trained as a midwife or a nurse, and they do further training, and they typically come to visit you towards the end of your pregnancy and also once you're home with the baby as well. and they come home and offer you support right up until the child is 5 years old. This is typically in the UK. I'm not sure how it works in the US or any other countries. Then you have your OBGYN, and I think this is more geared towards people in the US and possibly other countries. This person is medically trained and they offer support and advice on female reproductive health and pregnancy and childbirth. So I would say it's similar to like a GP in the UK, but just somebody more skilled in the field of obstetrics and gynecology. And from my research, I found that they typically do assist when a birth is higher risk as opposed to low risk. If it's a low risk birth, then midwives tend to deal with the birth process. But if it's high risk, then that's usually when an OBGYN would step in. And then the final person I wanted to refer to is a doula. Now, a doula, although not medically trained, they have a lot of experience and a lot of knowledge on all things pregnancy and birth, and they typically assist a woman through the pregnancy and the birthing process, and then also offer support after the baby is born and when you've returned home. Number 7 is birth plan. So what is a birth plan, I hear you ask? It's essentially a plan of how you want your birth to go. Sometimes it doesn't always end up going the way you wanted it to, and birth plans can then be altered, and healthcare professionals do recommend that you're quite flexible on the birth plan. It just enables your midwife, or if a doula is present, then they can just make sure that the process goes as you wish. So you might wish to decide on certain pain relief that you may or may not want, or whoever you want in the room is in the room at the time of birth, and also how you wish to give birth as well. That's important because you might want to give birth in a birth center and have a water birth, or you might want a medicated birth, or you might be staying at home and giving birth. And your birth plan, you would just lay out the sort of specifics regarding the nature of birth that you would like. Me, for example, I did yoga, and one thing that I wanted when I gave birth was to have dim lights and some essential oils burning just to help me to relax and calm me down. So these sorts of things of exactly what you want and what you don't want, if there is something you don't specifically want, be sure to include that in your birth plan, so then everyone's aware of how the process should go for you, provided everything is safe and well. Like, you might even decide after birth, so once baby is actually here, how you want them to be handed to you. So whether you want them to be handed straight to you and put straight away onto your skin, or if you want them to be cleaned up first and then handed to you. So that's what a birth plan is. It's just a way for you to plan and specify your wishes of how you want the actual process to go. And it just enables you to have more of a special experience. Word number 8 is labor. Now, this word can appear to be scary, but it's not. And labor is actually the process of childbirth. So there's 3 stages typically in labor. So the first stage of labor is typically when the cervix thins and you dilate, so then the baby can come through and you can give birth. The second stage of labor is you actually giving birth to the baby and delivering the baby. So that may be either you give birth yourself vaginally, or you may have an assisted birth, or you might have a surgical birth, depending on your circumstances. So the third stage of labor is when, after you've delivered the baby, you will then deliver your placenta. So this is the final stage, and this is when your womb contracts to expel the placenta. Leading me nicely into word number 9, which is placenta. So what is a placenta? A placenta is something I find highly fascinating. It's an organ that grows inside of your uterus. It's usually attached to the wall of your uterus, and it grows as baby grows, and it connects you to the baby. So the placenta is connected to you by attaching to a wall in your uterus, and that placenta then has an umbilical cord connecting to baby, and it's essentially a lifeline, which is so cool because nutrients, oxygen is passed from you to the baby, but also it passes any waste from baby back into you, and then you expel that. You would, once you've delivered the baby, you would then deliver your placenta, or afterbirth as it can be called as well. And some people even keep their placenta, they turn it into tablets that they ingest, and there's various things that can be done with the placenta. It just depends on your beliefs as well. Some people do store the placenta at home. Usually the hospital just bags it and disposes of it. Word or phrase number 10 is fundal height. Now this is a height that's measured from your pubic bone all the way to the top of your uterus. Now this height is usually used as a gauge of how far along you are in pregnancy and the size of the baby. So it can indicate how small or large a baby is. But you'll read this a lot in your notes, and also when you visit your midwife and they are checking your belly. Word number 11 is delivery. Now this word can be bittersweet because whilst it's the moment your baby leaves you and you have your baby, it also means the end of pregnancy. Now if you had a good pregnancy and you enjoyed your pregnancy, you will miss being pregnant. You will miss having the baby so close to you. On the other hand, if you've had a bit of a difficult pregnancy, then I'm sure you can't wait for it to end. You can deliver in a variety of ways. So either vaginally, or you might have an assisted delivery or a surgical delivery. So basically it just means when the baby leaves your uterus and they come through and end the pregnancy. Now you've heard me say surgical delivery and assisted delivery, so I'm going to get into that. Leading me to word 11 is cesarean, or C-section as it's more commonly referred to these days. So that is a surgical delivery. You can either elect to have a C-section, or you might have one where there is risk to, say, you or baby, or there is an emergency. And so a cesarean is an operation where they make an incision in your abdomen near your bikini line and then help the baby to come out that way, as opposed to vaginally. And then word number 13, or phrase number 13, is assisted birth. Now this is where baby needs help to be born. It can be called an assisted birth, an instrumental birth, or then more technically an operational vaginal birth. But the more common forms of assisted birth is using forceps or using a vacuum. So that's just a suction cup used on the top of baby's head to help them come out. And these methods are just simply used to assist you in your birth. It may have been that you may have a long labour, the mum might be exhausted from trying to push, or baby might need that extra little help. Maybe they're struggling and it can be a necessity to have an assisted birth. And so whilst it may not be planned, it might just be necessary to help baby along the way and also help mum as well. Phrase number 14 is, you might hear, baby is engaged. So baby is engaged. So what does it mean when your midwives might say baby is engaged? So this means that your baby is low down in your pelvis, that baby could be with you very soon, and that you are nearing the end of pregnancy. Now word number 15 is dilated. Now you'll hear this a lot. I'm sure through your reading and your researching, there's a lot of talk of what it means to be dilated. So you might have heard in like films or TV, okay, she's fully dilated, it's time to push now. So what does that actually mean? And I just want to add in another word here as well, which is effacement. Now, effacement is when the cervix thins And dilated is when the cervix opens up. So the woman will dilate from 1 centimeter to 10 centimeters. And when you're dilated fully, which is at 10 centimeters, that's when it's time to start pushing and you're able to then deliver the baby. You'll see it in your notes as well. Midwives might write like you're 100% effaced, you're 95% effaced. That just indicates the percentage of how much the cervix has thinned. So effacement typically happens towards the end of your pregnancy, and yeah, it indicates that you are about to give birth, but also it can happen before and then you don't start labor till even a couple of weeks after you have effaced. And I just wanted to add that women can also be like 1 or 2 centimeters dilated and they haven't even gone into what feels like proper labor. And some labors are so quick that you can go from 1 centimeter to 10 in the space of like 4 or 5 hours. So it just depends woman to woman and labor to labor. Now, phrase number 16, or the words, are mucus plug. Now this will sound a little bit gross, but we are talking about pregnancy and birth and the wonders of it all. So I'm not going to be hiding anything here in this series. We will be talking about the nitty-gritty as well. And I think it's important for dads to learn these things as well. So when you are doing your reading or Googling stuff or going onto forums, there'll be a lot of chat of mucus plug, or what's also called the bloody show. Now that just sounds scarier than what it is. It's not even something you may even feel. But a mucus plug is basically during your pregnancy, you develop this mucus that then collects and it acts like a plug. And it's just to protect the area and seal it. And when the mucus plug comes away, so sometimes it can be tinged with some blood, and this is why it's called the bloody show. So you might read where women are like, have you had your bloody show yet? Or I had my bloody show. Yeah, it is a sign that labor is soon to follow. Now, another sign that labor is soon to follow, or you are in labor, is when you say your waters have broken. So words number 17, waters breaking. So what does that mean when your waters break? So that's when your amniotic sac breaks, water, the amniotic fluid that was in the sac, then comes away. Now, whilst TV and movies might have you believe that, you know, there's like a powerful gush of water, it's all dramatic. It's not always the case. More commonly, it happens either like in short bursts, or it happens to be where it trickles, and it can just leak slowly as well. So you may feel like you've peed yourself and you're not sure, but sometimes, yeah, it can be like that, and that just means that your waters have broken. Now, word number 18 is epidural. Now this word can be music to many mums' ears through the process of birth, and once your labor is a little bit more established, that's usually when the epidural is given. Now, an epidural is an injection in your lower back, so it's in your spine, and it's a local anesthetic that's injected into you, and this just blocks the pain from contractions and when you're actually pushing baby out, or if you're having an assisted birth. So it's just like an extreme form of pain relief, and arguably the best one. I don't know, it just depends on the mums and what they opt for. But in recent times, it is more of a common form of pain relief. So this would be part of a medicated birth. Word number 19 is contractions. So this is when your uterus contracts, so just tightening and relaxing. And the intensity of the contractions during labor increases, but also the duration of the contractions increases as well. So contractions are the first stage of labor, and that will then lead you to the second stage, which is then delivering the baby. So you will have these contractions And from looking on the NHS website, it says once you've had about 3 contractions in the period of 10 minutes, that's usually when it's time to go to the hospital. Or I think it's every 3-4 minutes you're having a contraction that's lasting 1 minute long. And these contractions help them to push the baby out. So your midwives will say to you when you're contracting that on that contraction, can you now push? So the contractions are what is considered the longest part of labour, because you could be contracting, say, from the night before or throughout the next day before you actually reach the second stage and give birth. And now, words 20, the final phrase in this video is push present. Mums, you're welcome. Dads, get on it. Time's ticking. And make sure it's a good one. No, I don't mean to be cheeky. Push present is actually a gift from the partner or even the family to the mom, and it's to mark the occasion. And it is a little bit funny where it's a present that you're given because you've done a lot of pushing and all that hard work. But I quite like this idea of a push present. It's nice. A woman should get gifted something for all the hard work that she's put in. So usually your partner or even your family may give you a push present either whilst you're still in hospital after delivering the baby, or you may be gifted a push present once you've come home. And push presents can be anything. It can be something really sweet and sentimental, or, you know, if you want to go a little bit OTT and you want to be a bit fancy, you know, I've heard and read that some push presents can even be a very luxurious things like cars or a Cartier bracelet or a nice new handbag. It just depends what floats the woman's boat and what she wishes to have. I think, all jokes aside, what makes a cute push present is something of value and something that you can keep, you know. So a nice keepsake would be, say, something with a date of birth. Maybe if you've already got the baby's name, you might want to put their name on something, and you just keep that as a memento, and it's just something for the mum to cherish. So that concludes the video, guys. Thank you so much for watching. I really appreciate it. If you've not already subscribed, be sure to subscribe and hit the notification bell so then you know when a video does go live. And if you enjoyed this video, be sure to give me a thumbs up. It means so much to me, and you'll be supporting me and my channel. And I look forward to seeing you in my next Mummy Mondays video. See you soon, guys. Take care. Bye.